Hi there. I hope you've watched a much earlier video that we made that's called Cervical Facet Joints Assessment and Treatment. What's different about this approach is that here I'm going to treat the facets by simply doing longitudinal distraction from one vertebra to the next. So say, for example, if I decided that C2-3 side bent well to the left but not to the right, I'm going to simply release that level in what we could call a shotgun technique. So I'm only reacting to the reality that it's stuck, not what's the directionality of the stuckness. I simply want to be able to assess before and after to make sure that I got the result that I want. So the treatment would look like this. I would simply put my put one digit, whether it was a thumb or a finger, put one digit on the spinous process of C2 and one on the spinous process of C3, and then I'm going to notice when I try to move them away from each other, C2 up and C3 down, I'm going to feel a harder end feel than I do on the other adjacent vertebrae. And so I'm going to meet that end feel and then just gently distract and glide the bones through the resistance. No more than 10 seconds at the very most. I would have already assessed before, and now I will assess afterwards by putting my fingers there at the C2-3 facet, side bending both ways to make sure that I now have an even balance of mobility. So here are a few good things about this approach. Number one, if you're doing assessment and say, oh, I think there's a restriction between C5 and C6, you can just put your digits on the back of the spine and check where you think the space between C5 and C6 is. And if you check that space and the adjacent spaces, the one that is restricted is going to jump out at you and you'll feel much more sure that you have the right level. The other thing that I want to say about it that's particularly important is that as you do this in the neck, it will frequently be true that as you begin to release restrictions, you find more restrictions. So say a very, very common example is that you may assess at the OA joint and say, oh, I have to release the OA joint. And that after you successfully do, if you check the AA joint, the joint between C1 and C2, you may then feel, oh, actually there's a restriction there as well, and I need to release that restriction. So as in many other places in the body, it's important to start with your initial assessment, work to correct what you find, and then go back and check to see if there's something else that you need to correct. Thanks.